Mr. Lake, I'm really happy that you came in to see us today. This is quite the injury.
Yeah, I called a number in this end, didn't I?
Yeah, you really did. I don't know how you got this organism, matter. I'm not really sure exactly what to call this until we get just a little bit more abstraction underway. But I'm really glad that you came to see us instead of trying to do this yourself.
No, I definitely knew I needed to come to an expert because the lake water is a little not yucky looking water. So I feel like that's kind of where I got it, which is, my last name, Lake with lakes. I think it should give me some type of credit in there. But no,
No, I agree. And whenever you get into like natural bodies of water, lakes, ponds, even oceans, the bacteria and viruses and microorganisms that flourish in those types of environments are really very, very dangerous to the human body, especially in broken skin. Now, I'm really impressed with the way this came through. There's no blood, there's no discharge of any sort. All I see here is just literally this foreign matter that we're gonna be removing right now.
ooh, wow, I can feel it like kind of
Right?
doing a little dance around my finger.
Well, now, the good news of this is we've given you a very strong local anesthetic. We've used lidocaine here, just like if you were going to the dentist, to make sure that anything and everything that happens here will be completely pain-free. You may feel something like a pressure, perhaps a pull or a
It's
tug.
kind of like a tingling feeling. Yeah.
Great, wonderful.
But now that the real question is like, look at the tone in my fingers getting.
Yes, that's the thing. Like you've got just a little bit different skin tone between here and there. Number one, it probably has to do with the inflammation because of this foreign body inside the digit itself. Number two, I see that someone has wrapped your wound here. I mean, it's honestly, it's a very good job, but I think that it's probably just a little bit too tight.
Yeah,
Which is why the skin tone is slightly different from, say, your pointer finger to your middle finger.
Yeah. My sister Juliet, she's super aggressive. Let me tell you.
I really appreciate her enthusiasm. I do, but I'm glad you came to see us because we're going to be removing that to make sure that we don't lose any kind of circulation here. Right now, it's great. It's acting as a sort of tourniquet.
Okay.
Just to make sure that if there is any sort of infection, that it's going to stay localized right here in the fingertip instead of going on to the rest of the hand. Now, I am noticing that you've got a couple of cuts here that are healing nicely. Are those okay?
Yeah. I mean, when you were saying the ocean, I mean,
Right.
is it true the salt will make it heal? Ooh, wow! Look at that. That is coming now.
Exactly. See, that's part of the bedside manner. You make sure you distract your patient before you do something that could be potentially upsetting.
Yeah, you got me forgetting what we were here for, actually.
Honestly, you're doing great. You're doing such a great job. I'm happy to hear that this isn't causing you any discomfort. It's just a little bit of a pressure or a tingle, and that's exactly what I'm going for because I'm not exactly sure how long this organism is,
Right.
but
Yeah.
it's coming out right now.
So wait, is this gonna leave a little scar, or is it just gonna buff out, or what's gonna?
Well, sir, you are not a Chevrolet. So what we're going to do is whenever we remove the organism, we're going to put a couple of very small stitches in the fingertip.
Okay.
Just to make sure that we close that exit wound because we want to make
okay.
sure that we keep any and all foreign matter out of it. Once we wash it thoroughly with probably a saline solution as well as some betadine, and that will
What
kill...
is betadine? Is that even something I can buy over the counter?
It is. Betadine is something that you can buy at your local pharmacy or even Walmart or Target. It is a disinfectant solution. You have to be very, very careful with it. I'm going to use just a little bit more.
Yeah, I noticed
of the
you've been
lubricant.
using that, and every time when you use it, it just feels like it glides right out.
That's exactly why I use it, because the Vaseline is there. It's an excellent lubricant. It helps to move whatever this is inside your finger right out.
So wait, those pliers are like the jaws of life, or what's going on? Because I figure if you put Vaseline, it's just gonna slip away.
Well, these tweezers are very specific for these kinds of things. They have a really, really strong grip. You'll see that they're very thick at the tip. So in that way you don't suffer any bending. They don't flex at all. What they do is they grab hold of whatever the foreign body is to remove it as quickly as possible, which I'm very pleased with the progress. We've already taken this much out of the finger.
Interesting.
And I can't imagine there'd be much left inside. So we're just going to continue with this
I can see it
really.
going. So before I came here, I did a little bit of YouTube. Whoa! It's tickling again.
Good.
That is funny how it feels.
Yeah.
I did a little bit of YouTube University, and I noticed the other people that had something similar to mine. It's like a smooth surface. This one has like a rivet. I don't know
Yes.
if that's a rivet or like
This is what we call
beanbag.
segmented. It
Okay.
actually has these very small pinches throughout. So
Is it because it's eating part of my finger? Or
no,
what?
no. Honestly,
Wait.
I think it's actually just part of the organism because a lot of earthworms will have a segment right around the neck or collar area, and I think that maybe what we're dealing with here is more like a parasitical type organism.
Is this because it was in a river or a lake type of deal?
That is probably exactly why. Now, see, you'll notice that this is giving you a lot of stretch right here.
Yeah, like I wish I can explain the sensation I have right now. It's like a rubber band in there.
Yeah, I have to be very, very careful to make sure that I remove it all at once in one piece.
Wait. So you tell me there's been cases that it breaks and they just stays in there?
It does, and that's another thing too. I'm glad that you asked that question because if it breaks inside, like say we lose some vestigial limbs, some small hooks or feelers or feet or legs, it's going to be really, really important that we keep infection to a minimum or eradicate it entirely.
Right. What was the thing that you said? Saline or saline?
Betadine, yeah.
Betadine.
Now,
There we
here's
go.
the thing. Betadine is a really strong disinfectant. It also stains almost everything it touches. So that way you know exactly when everything has been covered and disinfected with the betadine. It's a dark red-brown color. And so whenever you get that on a wound or a fissure or anything like that, it's very easy to see. And they do that on purpose. They want to make sure that they color it so that you know exactly all of the surfaces that have been cleaned and disinfected. And so you don't have to worry about missing a spot. The entire wounded area will be completely disinfected when you use the betadine.
So wait, I'm confused. You tell me my finger might get stained. I have two-tone finger?
Well, only for a time. Just like right now, you'll see that the skin tone is different from the rest of your hand to this one affected fingertip.
Yeah.
Because you have just a little bit of circulation lost from the tighter bandaging. Same thing with your betadine. It will temporarily stain.
Look how far that stretch.
know, and
Wow.
I'm really trying to be very, very careful with that.
Wow,
I may need to get another instrument, so I'm going to very carefully place your
No, it
finger
feels,
down.
Yeah, no, that's fine. I think, yeah.
And I'm going to get...
Just make sure you don't lose it, all right? I don't
Exactly.
want that thing to slide back in. We've been going at it for a
Exactly.
couple minutes already.
No, I agree wholeheartedly. So what I'm going to do is get our pinchers here to hold that directly in place.
Oh, that means that those things are not going to slip.
They are not going to slip. They have teeth and ridges on the end. I'm going to apply just a little bit more of the lubricant to the
Yeah, that's key
to the
for sure.
wound exit. There we are. And I will continue to pull at this guy because the last thing I want to do is make any backwards progress. I want to make sure that all of our progress is moving forward.
Whoa, it's feeling like it's literally at the tail end right now.
Yeah, we are really close to having this guy completely and totally
Whoa,
out of your
that
fingertip.
is the sensation. I wish I can explain to you how it
Ooh,
feels.
I have to be so careful with something like this because if I'm not very careful, it could slide back inside the finger.
Wait,
because-
we have to start all over?
Well, this part right here, I think is as far as it will go because the segmented tip, this bit right here will not go back inside the finger. But this long, slender part has a very high likelihood of actually retreating back into the finger if I'm not very careful to make sure that I take care of all of my... Oh, there we are.
Wow, I loosened up. Wait, so
There
you
it
tell
is.
me like that's like the newer piece. The beginning is the older piece,
Yes,
right?
this piece right here is what we've already extracted from the finger.
Got it.
And this piece right here is what's coming out currently. I'm being very careful.
Sliding out just like you lubricated, like
Right? It's why it's so important to keep these so nice and slick with the lubricant.
yeah.
So
no,
we've got the
it's-
sterile lubricant
Yeah,
here.
it totally makes sense
And we
now.
continue to administer that lubricant here to the tip
Do
of
you
the
really
finger.
think I need stitches?
Just a couple. It's not going to be like you need 5 or 10. It's only literally 2, just to make sure. Because see right here at the end of the finger, this is a very large organism. It has a very wide circumference. And as it comes out, I want to make sure that the exit wound, this wound right here at the end of the fingertip, it gets a very clean stitch closed. So in that way, all the bacteria, the dirt, the debris, detritus, all those things will literally stay outside of your finger and reduce your likelihood of infection by easily 20 to 30%.
Oh wow. So wait, so you tell me there's gonna be a pretty decent scar? Because I know chicks love scars, but I personally don't. So I'm definitely.
Mr. Lake, I don't think you're going to have to worry. These other wounds that you have here on your hand will probably leave more scarring than anything that I'm doing to the tip of
I've
your
been putting
finger.
a lot of Neosporin over there.
Good. It shows. They're really healing very, very quickly and very easily. I can tell that there's a lot of very healthy pink skin around the side.
Wait, what does the pink mean?
The pink means that's just new skin, really.
Oh,
It's
okay.
literally growing from the outside in, and eventually, like this small one right here, that scab will probably just fall off it'll just peel off. I love seeing this because that means that healthy pink skin underneath is that you're not picking the scabs, you're giving them every opportunity to heal.
Yeah, I hear there's people they love doing that. My cousin James.
Oh gosh.
Man,
yeah.
let me tell you.
Please
sometimes
tell
I feel
him.
like he kits around, but that's what he does. Whoa, you
Right?
sold how
Look at that. Now-
that slid right out. That was like another inch and a half.
We're making some serious progress here, and I love that because we're getting to the very end of the organism. We've probably got close to 15 to 16 centimeters outside of your hand, which can only mean that we're getting very, very close to the end. So right now we're going to be extracting the very last bits of this organism, so we don't have to worry with this any longer. Now, if at any point you feel any sort of discomfort or any sort of...
No. I mean, as I
wonderful.
said, it feels fine, but
Great.
just the sensation of how, like, it feels like something is dancing around my finger. Like,
let me see. Give me 1 second. I'm
Okay.
going to move it just a little bit closer
Okay.
here into the light.
gotcha.
Wonderful. I'm going to hold it with our caliper as well again. Make sure
Yeah,
that the
that-
exit wound is very, very moist, very well lubricated with the petroleum jelly so that we don't have to worry about any tearing for that exit wound. It's so
Whoa,
important.
you mean tearing like like ligaments in there?
No,
or
no.
what?
Do you see
Whoa.
how the actual skin here, right as the foreign object is coming out of
Yeah,
the skin?
yeah.
That tear could get much worse if we're not very careful and attentive to exactly what we're doing.
I mean, Doc, you're showing your skills here. I feel like you've done this so many times. Oh, whoa.
Perfect,
Yeah, see how
perfect.
like you just
Yes.
so finesse with that.
Well, see, here's the thing. Do you see how you've got these nodules?
Yeah.
Here at the end, you've got 4 of these, and then you got this long, narrow section in the center.
Yeah.
So all I can figure is that nature is very symmetrical. If nothing, it's always very easy to predict on something. So if I have 4 nodules on this end, the chances are very good I'm going to have 4 or fewer nodules on this end. So
What does it mean if there's more or less? Is there a scientific proof about that?
Not particularly. It's one
So
of
I'm
those
ready to
things.
start counting. I want to make sure.
Oh, absolutely. Well, and 2, if we come out with fewer than 4 on this end, closer to the thumb that's still inside the finger itself, there's a very good chance that maybe there are segmented pieces left inside the digit itself.
Wait. So you mean you might need to cut it up a little bit and start digging in?
Well, I'm going to leave that to you because it could be one of those things where it could work its way out on its own. The human body is miraculous with foreign bodies. It will actually form an inclusion cyst, which means that white blood cells will surround the foreign matter, the foreign body.
It's coming, Doc. It's coming. Oh, there it is.
Look at that. Look at
It's
it.
like a
oh my gosh. We're so
tickling.
close.
It feels like someone's tickling inside my finger.
We are so close to finishing this up and getting you out of here. This is wonderful. So again, whenever I finish with this, what I am going to do is I'm going to prescribe an oral antibiotic.
Okay.
And we're going to make sure that you take a full regimen of that. It's only going to last like maybe 7 days. Very strong antibiotic.
Could a shot be quicker so I can my body, soak it in?
I would prefer you to take the oral, to be
Okay.
honest with you. It's one of those things where it's very, very effective, and I don't love giving an injection of antibiotic. Sometimes we'll give it a drip, depending on the severity of the injury.
It's coming.
Ah, beautiful. Okay,
Oh,
great.
wow. So we got 3.
We have
You
4 on this end, we got 3 on this end. I can't
Okay.
help thinking that we are almost there. So right now we're going to finish pulling this last guy out of here.
Are we going to take him to like a lab so we can figure out what
Absolutely.
it came from and
I'm
all
gonna
that
make
stuff?
Well, and 2, I want to know the sex of the creature that we're pulling
Wait,
out
so this
here.
is a male or a female?
Well, yeah, that's very important to know because if it's a female, they could have also laid eggs inside your finger.
Doc, I feel like it's coming right now.
It is coming
It's coming.
out
The
right-
last bit.
here we are,
Oh,
here we are.
Wow, it's still tickling.
Oh!
Oh, whoa!
Perfect. Oh my! Is
Look
that
at the
tongue?
tip.
What is that? Oh my gosh!
That's bizarre. It's like his tongue.